Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Uganda's population is dominated by young people, and about 78% of these are below the age of 35. This means that 7 out of 10 people you will meet are most probably youth. Studies have shown that they face a lot of health challenges, mainly lack of access to reproductive health information, which leads to potentially long-lasting health complications. As a result, many adolescents are left with no option but to drop out of school and later lead a compromised and vulnerable life as adolescents transiting into adulthood.
Most of the key issues there is health, their sexual reproductive health. We are seeing cases of teenage pregnancy, we are seeing cases of sexual and gender-based violence, we are seeing cases of child marriages, we are seeing cases of sexual transmitted diseases increasing, especially during the COVID period.
And this was exacerbated by the COVID-19 pandemic.
As the young people went back home because of the lockdown, most of them did not have the information that they needed to keep safe. The school environment had rules that was helping them, but at home, those rules were not there, and that's where we saw the high exposure. And so for us, one of the biggest lessons that we learned, and I emphasize this all the time, is that information is what young people need. Because when they are being exposed, when they are being lowered, you, the parents, the teachers, you will not be there. It's what they know. The information they have is what will enable them say no or say yes to some circumstances, or go away if they feel that they are being at risk. And so
Humphrey Nabimanya, the Chief Executive Officer at Richer Hand Uganda, says the present design of the economy leads to inequitable distribution of income, wealth and power, with too many people still living in poverty.
Abject poverty that young people have really faced, that has even hindered them not go back to school where they can attain education, but also how are we able to mainstream our programs in where the young people are, for them to have a very good environment they can go and make the informed choices in life that can enable them not to even be scourged to the different pandemics they are facing in their different lives. So the programming has to be improved. That starts from the family structure, the community structure, that also goes to the school structure to even support those young people in schools.
However, the Ministry of Health is finalizing modalities through which the adolescent health policy will be rolled out to try and reverse or even provide solutions to the existing challenges facing young people. Dr. Dina Nachiganda is the Commissioner for Adolescent Health at the Ministry.
Government is increasingly resourcing adolescent health programming in various ways, significantly in ensuring that they get the appropriate information that they need. Because we know that if they're informed of the various ways to be healthy and the various ways to live, then their health, they would be empowered. And so the information is given in different methodologies or different approaches. We have the different programs in schools, such as the PSA, the Sexuality Education Framework, but also at the health facilities, because we know that some adolescents are not in school. So at the health facilities, again, we are empowering the health workers wherever they are to ensure that they are giving the rightful information on health and generally health, mental health.
The policy states that approximately 52.7% of the population is under 15 years of age. 37.4% of these are below the age of 24. 23.3% of these are adolescents between the ages of 10 to 19. This means that 1 in every 3 people is a young person and 1 in every 4 people is an adolescent. The Youth Country Coordinator for the Right Here, Right Now program at Reproductive Health Uganda says government should recognize roles which the private sector has to play when it comes to implementation of policies.
When you look around the society where we are, there are different organizations, there are different service providers who give different services that young people, who provide different opportunities where young people can be able to have these services. So young people could be assertive enough to reach out to the different partners, to reach out to the different stakeholders and voice out their needs. With there, they will be able to get the right information and have access to the right healthy needs.
And these policies that will enable the health services to be delivered effectively to young people, will enable young people to access information that they need, will enable them to access the services that they need in a friendly way. The second one is around resource allocation, because everything that we're talking about, if we want to improve health service delivery to young people, we must allocate resources and specify them to the health needs of young people, and that is really very, very much important. The other thing that we recommend is that the issues around access to sexuality education for young people, these must be prioritized, because most of the young people which are being exposed to health challenges are young people who do not have the appropriate information. And yet it is our responsibility as a nation, as the teachers, as the parents, to make sure that these young people get the right information. And sexuality education is the key to that. Yes.
Okay. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.